Police making arrests today inside the U.S. Capitol. This is video from the area of the office of Florida Senator Marco Rubio. We have not been told yet how many people were taken into custody, but we know there were some arrests. And all day here on Local 4, we've been trying to help you get to the bottom of the battle over health care. A quick look at where things stand right now with the Senate proposal. Of course, yesterday, the Senate Republican leader Mitch McConnell announced a vote on the bill would be pushed back until after the July 4th holiday, not tomorrow, as was originally the design. That's happening because they don't have the votes to pass it. The GOP needs 50 votes to pass the bill. The tiebreaker would be Vice President Mike Pence. Right now, though, there are 9 Republican holdouts. Let's take a look. There are some notable names on this list, including Texas Senator Ted Cruz and Kentucky Republican Rand Paul, who has now released a list of 4 changes he's demanding be made to the bill. But the question is, if you make those 4 changes, do you lose Republicans on the other side of the scale? What is in the bill? For that, let's turn to Dr. Frank McGeorge here with a look at the nuts and bolts of 147 pages this go.
Well, exactly, Devin. You know, and understandably, a lot of people have serious concerns. So we went out and talked to people around Metro Detroit. And here are some of the most common questions and answers as things stand right now.
Well, I'm worrying about not being able to afford it.
I think it should remain affordable for everyone.
Affordability is huge. While the Affordable Care Act, or Obamacare, did many helpful things, there was a side effect many people with insurance experienced: increased premiums with increased deductibles and copays. The new proposals will have an effect on premiums. It's likely that the cost will decrease for younger people to entice them into buying insurance, but increase for people over 50.
My concerns are that it won't cover women's health, especially abortion and birth control issues.
Under the Affordable Care Act, Planned Parenthood services were largely covered. Under the new plans, there would be a 1-year block on federal Planned Parenthood funding. Coverage under private insurance could be determined on a state-by-state basis.
We definitely hope what survives is the requirement that insurance companies accept you regardless of pre-existing conditions.
Currently under the Affordable Care Act, coverage cannot be denied or cost more because of a pre-existing condition. The House bill would allow insurers to charge more or exclude some people with pre-existing conditions. The Senate bill does not do that, but it allows states to waive or change coverage for medical conditions, and that would allow insurers to exclude coverage for them.
I guess like everybody else, I'm kind of leery and kind of frightened. And one thing that's bothered me the most, I have a daughter that's disabled and she's on Medicaid. And I would hate to have that taken away from her.
My mother's getting older. She's in her 80s now. So her health care, even the Medicaid, for her, they're changing it. And I don't know if they're changing it so it can help.
The Affordable Care Act expanded Medicaid for people in general and specifically to people with disabilities and for mental health services. The newly proposed bills would significantly cut federal Medicaid funding over a period of years. In Michigan, that could trigger an immediate decrease in Medicaid coverage. Now, health policy experts say it is the proposed cuts to Medicaid that could hurt the most here in Michigan. So we are joined by Help Me Hank. And Hank, you've got a closer look at that aspect.
Yeah, in fact, at 5:30, we're going to take a close look at the Medicaid issue and how it could affect thousands of people living here in Metro Detroit, especially those who are considered low income.
This Medicaid expansion is why you've seen governors getting so involved on this debate. A puzzle with so many pieces, and of course the puzzle keeps changing day by day. Our coverage of the healthcare crisis continues, so stay right here. Karen?